Hi, everybody. Welcome to today's session. My name is Raisa. I am a radiology research fellow at the Children's Hospital of Philadelphia. Thank you so much for being here with us today. And I am absolutely honored to welcome someone that you all know, Dr. Amal Saleh. Dr. Amal is an associate professor of radiology at the Addis Ababa University School of Medicine. She is an expert in neuroimaging, artificial intelligence. She's also the vice president of the Ethiopian Medical Association, and she has been honored with their Rising Star Award. She also is the vice president of the African Society of Pediatric Imaging. She's also one of the editors of Pediatric Radiology. She has served on multiple organizations. She has served multiple leadership positions, and she has been instrumental in improving education and clinical radiology practice in Ethiopia. And we are absolutely excited to hear from you today, Dr. Amal. The floor is yours.
Thank you very much for this kind introduction and for inviting me to speak today. And thank you everyone from wherever you are in the north or the south for joining to hear my perspective on the implementation of artificial intelligence in neuroradiology, the challenges and the opportunities in resource-limited setup. My talk will skew towards the challenges as that is a main limiting factor in implementation of AI. So having said this, I have nothing to disclose relevant to this talk. So when we're talking about this, I want you to first understand the background and the environment that we're in so that you can understand the challenges that we face. So I'm in Ethiopia, which is, when we were growing up, it used to be called the Horn of Africa, but now Sub-Saharan Africa. And it's a completely different setup of what you might find in the global north. So this is my institution. It's Tukur Ambassa Specialized Hospital, which translates to Black Lion Hospital. It's one of the largest referral hospitals in Ethiopia, with a 663 inpatient bed, 46 specialties and subspecialties, and over 950,000 OPD attendants this year, the past year. So why do I mention the size of this hospital and the facilities and the work and the educational aspect of this institution? This is because I want you to understand that this is what we have available to us in my department. So we have two CT scans in my department. A third one is shared with the Department of Oncology, one MRI. We have several ultrasound machines. We have one digital X-ray. We have one mammography with the second one en route. And very recently, a PET CT, which is installed due to the kind donation of the IAEA. So when I say we have one MRI, we have one MRI in the MRI room, which is mostly non-functional, and it has not been functional for quite some time now. And this is quite critical in understanding the challenges that we face in our institutions. Just to mention a few points about what kind of educational programs are run in our institutions. We have an undergraduate program in the School of Medicine for medical students and other specialties or undergraduate programs like medical radiologic technology as well. And in my department, we have a postgraduate program, we have residency program, we have 5 fellowships. The 6th one that we're working on is breast imaging, which is in the pipeline with approval of curriculum pending. With regards to neuroradiology training, which was established in 2016 in our institution, initially with collaborators at Emory Institution under the guidance of Professor Pat Hudgens, and then now our collaborators are UPenn. And it's also important to understand that during COVID, we also had support when our Emory collaborations failed with Health for the World, which helped with our fellows in terms of one-on-one, case reviews and lectures and so forth. So far, 7 people have graduated from this program. I was one of the first to graduate from this collaborative work, and we have 3 fellows right now. Just to mention, I was looking at some publications to see and understand, what is out there, and wanted to see the global trend in artificial intelligence-based publications in radiology, and spanning from 2000 to 2018. This is a nice paper that I saw, and I was looking at the countries in order to understand what is going on in our setup. So among the countries that are mentioned with the highest publications in artificial intelligence, you can see that there are no African nations on this group of countries. We have India, which is in some cases regarded as a low middle income country. So that might be the only global south-ish country in this publication shared. And in the same paper, it mentions that neuroradiology subspecialty produced the most AI publications in the study. Another paper showing the trend of artificial intelligence in radiology and the implications in terms of neuroradiology, which was published in 2020. What about publications from the continent? There's really limited publications on AI. If you search for AI in Africa and any publication, and then even more limitations with regards to radiology, even further fewer publications on neuroradiology. You will find some preprints available with some really, really good papers that are in the preprint phase. And I will share some of them with you. And so I want you to ask the question of why is this an issue? Which leads us to the challenges. So I think the challenge of AI and implementing it in resource-limited setups like Ethiopia is quite complex. So I've tried to group things in a way to kind of simplify them. So in terms of protocols and the image, this is related to the data quality. And if we look at the expertise, data sharing and storage, and which has implications cost-wise. And of course, data ownership is also an issue. So trying to look at the different challenges with regards to protocol, it's important to understand that the sequences that are done on MR machines, particularly, I will focus on MR, is quite different from one institution, be it public or private, in our setup. The slice thickness is not consistent. We get images 5 millimeters or 8 millimeters sometimes from outside institutions when they come to our department for second opinions or for MDTs when we're discussing on images. As our MR is down, most of the images that we get comes from private sector or other hospitals outside of Black Lion Hospital or Tukuran Hospital. The coverage of, for example, if you're doing a brain MRI, sometimes the image might be cut off where the skull base is not included, or the centrum semiovale is somehow cut in some instances, which is quite challenging. And most of our private sector or government hospitals do diffusion weighted and ADC maps, but maybe sometimes that might not be available in the images shared. Most don't do susceptibility weighted image or GRE sequences, and very few do MR spectroscopy unless it is indicated in some cases. So this has implications in the reproducibility of images, which is quite important in data quality. The other thing is the image quality itself. So the magnet strength that is available in our country mostly are 0.3 Tesla MRIs, which have a relatively poor image contrast and resolution. There is some shift with purchase of new equipment, and most people are leaning towards acquiring a 1.5 Tesla MRI, but most that are available are low Tesla MRIs. And this has implications in terms of doing advanced imaging, such as MR spectroscopy. If we want to do it, you can't do it on some of the machines that are available to us. So just to show you some examples, so these are diffusion weighted images and ADC maps, which were done on a 0.3 Tesla MRI. And I want you to compare it with this one, the bottom images, where this was done on a 1.5 Tesla MRI. And you can clearly see how beautifully you can make out the finding, which is this hyperintense lesion on the DWI and hypointense on diffusion and the EDC map, as opposed to this grainy, poor resolution image that you see on the low Tesla MRI. The other, I think, a very, very important thing to mention is the challenges that we face in pediatric patients, where you will have motion artifact because we sometimes have difficulty in administrating anesthesia to our pediatric patients. When our MR was functional at the Tukuran Hospital, we used to do pediatric imaging every Friday, where somebody from the anesthesiology department would come down and we would book the whole day only for pediatric patients in order to get good images with less motion artifact. So these are images that were taken at my institution a while back, and you can see that there is some, motion artifact. So these are things that can, you frequently encounter in pediatric patients, which is quite challenging in terms of the quality of the image. What about the expertise? So when I talk about manpower, I think it's important to put it into two different categories. For me, since this is a neuroradiology related topic, I want to talk about the number of neuroradiologists in Ethiopia. So there are 12 that I know of, but maybe there's a 13th person. I'm not quite sure, but this is what I know. And from in Ethiopia, we are a population of 120 million and rising. And only having this number of neuroradiologists for Ethiopia is, extremely low, to say the least. From these neuroradiologists, 8 of us are at Black Lion Hospital, and the remaining, everybody else is in the capital city of Addis Ababa, where we're situated. So it's very, very clear to see that there isn't a lot of, distribution of neuroradiologists in the whole of the country. What about neuroradiologists with AI training? Maybe 1 or 2 with basic training. I don't have figures, hence the question mark. How many of them are able to do annotation and labeling? I really have no data, but I haven't come across anybody that I know who does it, and I do have some basic training in that, but it's quite difficult. What about technologists and radiographers and physicists and data scientists, which are important? IT informatics people who should be on board. And Addis Ababa University has a computer science department, and one of our attendees is from there, which I'm really excited to hear about. But as far as I know, there's no existing collaboration with neuroradiology in my department that I know of, who is working with data scientists in our own, Addis Ababa University, which is a huge university with multiple colleges and departments. So this is one of the challenges that we see. Data storage and sharing. So, picture archiving and communication system, or PACS. It might seem like a small thing for people in the global north, but it's very, very important to understand that these are not readily available in all centers in the country. And there's an even more, there's a disparity between public versus private setups as well. So in my institution, we do have a PACS system, which was, kindly donated to us by Rad Aid. And if available, the PACS that we have come with very basic functions. So for example, if I want to do research on glioma patients, it's not like I can type in glioma and all the images that I want will pop up. So it's tedious work. You have to go through the images, or maybe if you come across cases that you think are important for research, then you'd have to put it in a separate file, or you'd have to, write down the EMR number so that you can go back and find these cases. So, in the global north, it's quite easy. You can just type in whatever you want and everything pops up for you, which is not the same where we're from. The other very, very important challenge is the accessibility to previous and follow-up images. So It's challenging to biopsy all the cases that we come across to find, to make a definitive diagnosis. So, patients go to different private setups to get one image. Maybe their follow-up image is done at another institution. Then they come to you, and then you want to look at the previous image to see if there's any change. Or maybe you want to request for a follow-up image. You put certain differential diagnosis for whatever lesion that you've seen, and then you want to order follow-up images, and the patient doesn't come back, so you don't know what happened to that case. So it's a huge challenge. So you are, baffled by some of the things that you come across, and you really don't have a definitive diagnosis. And of course, then the image storage is not there at all. Images that come to us from different hospitals or other private diagnostic centers, it's impossible to share among each other, and hence most of the images come to us. The patient brings the CD with them, or nowadays, some of the images are shared on some apps or so forth. CDs, it might seem like a very good solution, but what you have to understand is, the patients might not necessarily know how to, keep track and keep it safe. Some of them come to us that are scratched or broken. Patients lose their CDs. So it's very, very difficult, to make sure that we archive these images and keep them for future references. And of course, the data storage, the medical imaging hardware is a limitation. The servers might not be available. If you have them, they're outdated, so they're slow. Cloud services are, sharing, keeping them safe is a challenge. So, for example, power fluctuations have caused significant issues for us, where we had a power outage in my institution a few years back, and our backup generator ran out of fuel. The UPS stopped working, which eventually impacted the PACS. And we had quite a big scare where we couldn't access the data of the images of the patients that we had for like 3 years or something. So, at that time we had to, think about investing and, putting everything on a cloud server. This is challenging because you have to pay for them, and you have to pay in foreign currency, which is not, easy to come by in some institutions. And of course, electronic medical records are not readily available in all institutions. Some bigger institutions have them, some don't. They are not compatible with each other. You start using one system, one EMR system, and then management might decide to change and move to another one. Then everything changes. We're grateful to have it, but sometimes it comes with some challenges as well. So this means resource, which is hard to come by. And it's very, very important to understand this. It's not a problem of understanding the need. It's just that you might want it, but you might not be able to get it for, resource is not there. What about data ownership? I think this is very critical and very important to get it right from the beginning. So what are the policies and regulations? What are the ethical considerations? What is the IRB doing about it? Are we doing research with proper IRB? And what about the culture of sharing? I think we're not there yet in terms of sharing data. Is it a trust, mistrust? You can pick which word that you feel comfortable with, but it is a question of, not knowing where your data is going, who has access to the data, what are you going to do with the data? All of these are important questions that might not seem as important to some people, but I think should be very clear from the beginning. So these are very challenging things. So, trying to put it all together, I think one way or another, everything is related to cost, the lack of infrastructure, we've already talked about the power fluctuations, the internet speed. For example, I am not home presenting this. I'm somewhere else where there's a stable internet, because I don't want, power to go off, then my internet will go down, then, I'm not going to be able to present to you. So I have to be somewhere where there is, an excellent internet service, where there's a backup generator just in case there's a power failure. So imagine this is for one presentation, but think about it in terms of AI and what it means. We've already talked about data storage and access and people. People cost, you don't usually relate, manpower and expertise with cost, but it's very important to understand that, training somebody to be a neuroradiologist takes time and effort and money. So you have to do medical school, then you have to do residency, then you have to do fellowship. As you're all aware, you are either medical students or related somehow in the field of medicine. So it's very, very important to understand. And as you know, AI requires a large data set for machine learning to be done. So, where are you going to store it? And we've talked about the CD that, how many CDs are, and how are you going to put it into a format where, a nifty format or whatever that you need to make sure that you can use it for machine learning or to implement state-of-the-art AI tools. So you have to understand that this is also very, very important. So neuroradiology applications. I know most of you are excited to hear about how we're applying AI in neuroradiology, but I just want to mention a few things here. These are things that everybody, knows with artificial intelligence. Image acquisition and quality. Standardizing scans, denoising or sharpening. Poor contrast images to a higher contrast, where you can in times you see that when you're trying to denoise and sharpen the image, what happens is sometimes you have you can't see the findings anymore, and this is one of the challenges that you face. Quantitative analysis, there's so much talk about tumor segmentation. And I know on this platform, you have talked about, metastases and meningiomas and applying AI and, segmentations with regards to that. And of course, there's a lot of talk on and a lot of work being done on stroke and vessel occlusion, white matter lesions, ventricular size, and so forth. But for me, I feel like there's something very important that we're not talking about. And what's missing is, for me, infection. And if you search AI and infection in your radiology, you will come up with some publications in some areas, but I feel like there should be a lot more that should be done in terms of, applying AI in our kind of setup where infection is still quite a big challenge, and which can, improve a patient's morbidity and mortality. For example, if you diagnose a patient with a high-grade glioma, it's great that you can use AI to make a good diagnosis, but we all know the life expectancy of patients who have high-grade glioma, even in the best of centers in the global north. So what can we do for patients in the global south is very, very limited, where you have very few radiotherapy centers. For example, in my institution, for the longest time, the only radiotherapy center in the whole of Ethiopia was at Tuqran Hospital. So patient waiting time was over a year. If you came to our institution with a stage 2 disease, while you're waiting, you might not even make it long enough to be called to come for an appointment. And it's quite disheartening when you have to call family and say, it's time, it's your turn to come. And patient is quite, families are upset, and they cry because they've already lost that person, or they're so far advanced that you have to do everything all over again, and the outcome is quite poor. But with infection, we can treat them and we can change their life. So I think it's very, very important to apply it in infection. Workflow improvement is a big talk in AI, but how are you going to improve workflow when you don't even have a PACS system or an EMR system in place? Report generation and helping neuroradiologists make their life easier. For example, if, in detection of subarachnoid hemorrhage, where the AI might tell you that there is no detection of hemorrhage, which kind of helps neuroradiologists make decisions. But what happens with medical legal issues where there is no guideline or policy in place with implementation of AI in report generation. But not as, not everything is dismal, there are opportunities. But I want to talk a little bit about why we're having this discussion. And you have to understand that most of the state-of-the-art AI tools are developed with, in the global north, or using data coming from areas which have excellent image quality with reproducible imaging protocols, with great archiving systems and high Tesla magnets. But can we apply existing AI tools in the global south, where the AI tools are not trained on underrepresented data with limitations in image quality, with very limited access to MRI? Not everybody has MRI in their institutions or in their country, for that matter, and with the poor access to data. And of course, we've talked about the quality of the images. But in terms of the opportunities, I think we have to talk about the way forward in terms of how to work around this problem. And I think we should start off with education locally initially, train and start early, integrate AI solutions and AI opportunities from undergrad to residency and in fellowships. And this was research done by one of our residents a few years ago, which is a preprint. This is not peer-reviewed, so I want to make sure that this is clear, where they tried to look at radiology residents and radiologists' perception and attitude towards medical AI in radiology. And you can go ahead, you can find this if you search for it, and you can see that there is a very positive outlook towards implementation of AI and machine learning among radiologists and residents as well. And I found it quite interesting that it says like 83% of residents thought it should be integrated in our curriculums, and there was an overwhelming positive outlook on this matter. So, which is, for me, a very positive outlook towards AI in radiology, where there is a lot of skepticism around the implementation of AI. Another thing that I thought was really an excellent opportunity was educating AI experts. So there's a program called Spark, which I was involved in, where I found it to be very helpful for me, where this initiative is a sprint AI training for African medical imaging knowledge translation, which came about to create awareness, to find solutions, and to educate using a holistic approach. And in improving the skills of a new generation of AI African experts, where they use the brain tumor segmentation challenge, to develop state-of-the-art AI solutions, or tweak or improve AI solutions that already existed by using data which is readily available, and also adding to that data coming from underrepresented countries in Africa as well. So this, I thought, was an excellent opportunity. And right now there is a call out for anybody who's interested to train on this to apply for the upcoming group of new IT experts, data science people, as well as neuroradiologists and radiologists as well. So it has a holistic approach in terms of integrating both radiologists and clinicians, as well as data scientists. And of course, another very important thing that I thought was really nice was the implementation of this, which is also kind of related to Spark, but where they try to, you can read on this using the African Neuroimaging Archiving to create an approach for democratizing AI in medical imaging, which is quite important to have a data set from the global south, or from Africa particularly, where we can use it to train AI models. The other thing I think is reassurance, where, like I mentioned, where AI sometimes can be perceived as, is it always good to use? Is it important to integrate and so forth? And we have to understand that it's not a replacement for humans per se. Radiologists and radiographers or radiology technologists. There was a fear at the beginning of the AI rush where everybody thought radiologists would be, the first ones to go because of the implementation of AI, which is, we find out that this is not true. But we can start off by integrating AI in improving image quality. But like I mentioned, we have to be very careful on how we apply it to improve poor contrast of images that we have, and make sure that the data is usable. So we have to be quite careful with regards to this. What about ethics? For me, I think I find this to be very important, and I feel like people should not try and bypass the ethical considerations when it comes to utilizing AI. So institutions and institutional review boards should be on board and understand the complexities behind using data for developing AI solutions and so forth. And this is even more difficult when we're talking about, trying to do research with multiple institutions, which makes it even more complicated. So in a recent meeting that I was attending, they were talking about using AI and trying to work with countries, even in the global north, where sometimes approval from IRB takes 1 year. So we mustn't feel disheartened, and I feel like we should also appreciate the people who have put these stringent measures in terms of safeguarding safety of patient data or whatever it may be. So I think it's important to understand that this is very critical. And the data privacy and security issues, the policies are in infancy. There is a lot of work in Ethiopia going on about data privacy and AI implementation, not just in health, but in general in the country with different sectors as well. And data management regulations are, I think, very important. For me, the way forward, I think it's very, very important to collaborate. When I talk about collaborations, I think there is a disjointed work probably going on where we have data scientists working on something. So in our institution, in the computer science department, I'm sure there are a lot of people who are doing a lot of work on AI. It might be related to health or other things, but I know there is work going on, but I don't know how much of that work is integrated with people who are concerned with the implementation of AI. So neuroradiologists and radiologists, are we working together? And as far as I know, I have not heard of one that is ongoing at the moment. Neuroradiologists and radiologists, I think, like we mentioned, should be trained at least in basics of annotating images and looking at the quality of the data set. And I think data scientists can use AI tools that already exist. State-of-the-art AI tools are already developed and are out there. And do we have to reinvent the wheel? I mean, if it already exists, I think it's important to work with whatever is available and make it train it on data that is coming from the global south, which is very important because there is some preprints available that show that state-of-the-art tools in neuroradiology do not necessarily work well with data coming out if you try and implement it with data from the global south for whatever reasons that have already been mentioned so far. What about among different institutions in country, in Ethiopia, in my own institution, like I said, I think it's imperative that we work together. There are many institutions in Ethiopia that are working on AI. I know in Jimma there are people who have been, working on the BRATS challenge with data from there and working on AI tools that already exist. But are we working with Tukurambasa Hospital and Jimma? Are we working together? Are these happening in neuroradiology specifically, not other AI implementations? And what about in Africa? We have 54 nations, and are we working with each other? The Spark Challenge, I think, has been quite helpful in linking, people who are interested in AI and the implementation of AI from Nigeria, from Ghana, from Egypt, from Ethiopia, from Tanzania. All of these countries have been, trying to work together in using the AI tools that exist, even from Nepal as well, who have been part of that challenge, which has been really, exciting that not just in Africa, but with other countries in low-middle income countries or low-income countries. So not only that, but it's also important to work with experts in the global north as well, who have the expertise, who have been doing this for so long, that we should, share our knowledge with each other. And for me, collaborations, and I've always said this on different platforms, I feel like collaborations have to be a two-way street. It's not a one-way street where, it's, somebody takes and, you're not working together. And collaborations always fail if it's not a two-way street. So if you want collaborations to thrive, I think you have to understand each other, and it should be a win-win situation for both. In terms of research, there is great potential there. Like we've talked about with tumors and stroke, which is coming, the big talk in AI. But I still feel, infections are something that, people who have a vision should think about. It might be difficult to implement, but at least start thinking about this. So I think that's quite important. AI has a massive potential. It has, the opportunities are staggering, but I would enter with caution. Not everything that glitters is gold. So, I feel like measured steps are also important where, they're relatively new where we are, where it hasn't really taken off as much as it has in the global north. So I think it's quite important to kind of take a step back and, get a feel of how to use it and then, go for it as well. So I would enter with caution here. This is a nice paper that if you want to know more about the challenges and the opportunities and the work that has been done in other African countries or other, not just African countries, LMIC countries, and global health in radiology, that it's a really nice read if you want to, dig more into this and understand the complexities, which is, I cannot cover the whole issues with this session only. Lastly, I want to talk about this. So these are 3 cases with 3 different diagnoses. I don't know if there are any radiology residents or I know some of you have some training in annotating images, and I want to see from the floor what you think about this. Raisa, is it possible for the audience to chime in?
Yes, I am not a radiologist, not yet, but it would be
Anybody
great
who feels comfortable.
anyone in the audience is comfortable with commenting on these images.
What do you think these are? I'm going to keep it simple. Is it a stroke? Is it a tumor? Is it an aneurysm? Do you think all of them are the same or not, or whatever is in your mind? I have shown this image on many, many talks because I want to put something across. So you might have seen this if you've seen any of
Yes,
my
we have Kebron and Akshay in the audience. We would like to hear from Kebron first, since you raised your hand first.
Okay.
Thank you, Dr. Amal, for the nice presentation. you have tried to cover all our challenges and the opportunities. The cases look similar, but on the left corner on there is a huge mass with irregular enhancement. So in our setup, I would like to consider tuberculoma. And on the middle image, could also be infection like tuberculoma, but both of these lesions can mimic tumor, and someone may consider tumor. On the right side, I'm considering more the tumorous lesion, like high-grade glioma. For the first two, maybe I consider tuberculosis.
Thank you, Dr. Kebron. He's right. There's a reason why Kebron has understood the reason behind this presentation. And these are the diagnosis of the patients. And I know this is unfair. I've only shown you the post-contrast weighted images. And the first case was a TB case that was one of the challenging cases that we faced even before I was a fellow in the early days, where it was a young patient who came from the northern part of Ethiopia with a possible diagnosis of a tumor, and the patient was operated, and later on the pathology came back as tuberculoma. The second case is a high-grade glioma, and the third one is an ependymoma. So for me, why can't we use AI to work on CNS TB? I have been working closely with AI experts with regards to this, and we have Department IRB approval where we're working on this case and these cases, and we want to know if we can use already developed AI tools, state-of-the-art AI tools developed for glioma, and can we train it on tuberculomas or TB meningitis as well. I have tried to look on literature regarding tuberculoma and AI. There is very, very, very limited research. There is some coming out of India working on TB and meningitis, but I feel, that we'll see with the data that we have how much, what's going to happen with it. But I think the conversation should be made that there is room for AI and infection. Yes, there are a lot of tools that have been developed for, pulmonary TB. That's been going on for a long time. And I know there's research going on in Ethiopia with utilizing AI for pulmonary tuberculosis, which is great. But I am a neuroradiologist, and this is what I see. So this is what I want to work on. And this is a very important thing. And I hope we will be able to share the findings of our work. I don't know when, but hopefully soon. But it's in the early stages. So this is something that I think has potential that we have been working on, and hopefully we will see what happens with that. But I want to encourage, experts in AI or data scientists and people out there to look beyond not just tuberculosis, but other infection that we could potentially use for the greater good in making an early diagnosis. So if you make a diagnosis of a high-grade glioma in a patient like we talked about, versus if you make an early diagnosis of tuberculosis, you are improving the morbidity and mortality of a patient. And I think that is critical in a country where we don't have enough trained radiologists and neuroradiologists. So having said this, in summary, I think AI should have a place in LMIC or Africa or other countries where we have complex data sets. There is an increase in non-communicable diseases. What about infection? and radiologists, neuroradiologists versus the population in our nation. There is a lot of brain drain going on in our country right now, which is beyond the scope of the discussion, but it has an impact on the services that can be provided for our people. And is it sustainable? You know, the number of radiologists and neuroradiologists graduating versus, you know, the change in dynamics of imaging in Ethiopia. And in summary, like I said, you know, there's a lot of good tools out there that we can use for good patient care and for research. I feel we should embrace it, but I put a question mark there because not everybody might be convinced. But, you know, like I said, you know, enter with caution. And I feel it's extremely important that underrepresented data coming from the Global South should be used in training AI models. And for me, ethical responsibility, you know, it has to be done ethically. And, you know, I don't think shortcuts should be made and with this regard. So finally, I wanted to share this because I was just preparing for this talk, and I don't know if there are any French speakers here. I don't want to butcher the French language, but this is the palace of our last emperor, which is being renovated at the moment. And I had the you know, opportunity to go there a few months ago when I took the picture on the right. And this is a picture shared to me by a friend. And on the gate, whenever I'm going downhill in front of the palace, you know, you're stuck in traffic and you are looking, you know, around you. And I noticed on one of the gates that there was some writing in French, and it says "L'union fait la force," which is translation, there is strength in unity. And I think it's important in my, you know, you can interpret it in any way you want, and it can work for anything. But for me, the unity is, you know, the collaboration that we can do with institutions within our country, within different countries. If you want to do, you know, something for the greater good, I think the way forward is, you know, working together and, you know, not being in a corner somewhere, and trying to develop something that you can use for humanity, in my opinion. And you know, with the recent AI events that are going on and not related to radiology, there's a lot of change happening. But I think if we stick together, we can do a greater good. And with this, I would like to thank you all for, you know, attending this, and I hope it was worth your time. If anybody wants to reach out, these are my contacts. Feel free. So thank you very much.
Thank you so much, Dr. Amal. That was fantastic. And I have to say that I never really saw any PACs when I was training in medical school in South India. There probably were 1 or 2 PACs, but not the ones that were obvious to medical students. And the first time I saw PACs was when I came to the US, and just I was mind blown by the difference in settings between the US and where I grew up. So I want to start off, we have about 10 minutes for questions, and we will quickly try to accommodate as many questions as we can. So I want to start off by asking, from your experience, what has been the impact of the MICAI Sub-Saharan Africa challenges on radiology practice in Africa?
I think it has had great impact. I mean, I can't really speak for everything, but during a conference at MICAI a few months ago in Morocco, where I presented something similar with regards to this, and I was really, really happy that Clinicae was also there, where they were integrating data scientists with clinicians. And then there was Africae, which was a side session that was going on, which was really great, where they were trying, you know, to bring the African continent into the whole, you know, talk of, you know, data and AI work. So I think there's been, you know, an incredible improvement in inclusion of African data sets with the BRATS challenge as well as MICAI. So I really want everybody to, you know, explore and look at the potential and the possibilities that are out there. So I think it's been really wonderful. I've certainly gained a lot from it.
Thank you so much for that. We have Erhia, who wants to say something.
Hello, good evening.
Hello.
Thank you very much for the presentation today. My name is Erie, Dr. Erie. I'm a radiology resident in Nigeria, Lagos, Nigeria, the Lagos University Teaching Hospital. I'm in my 4th year of residency in radiology department. So this has been very insightful. Of course, we have a PAC system, but we are still developing, communication with the EMR in our department with the rest of the hospital. Because our hospital is a federal teaching hospital, so it's a big one. But I'm really interested in, there was something you talked about, the Spark initiative. So that is something that I feel I'll be interested in, because neuroradiology is one of the areas that I've thought about in features of specialty, when I'm done with my residency training. So those are the areas that I've thought about. But overall, this was a really insightful presentation. I learned a lot, and I think I will reach out to you on X, because I found out about this through X. So I'll reach out to you. Yeah, thank you very much.
Thank you.
Thank you so much. Next, we have Marco.
Hi, thank you very much for the really actually inspirational talk. Seeing that there's only 12 radiologists or neuroradiologists in Ethiopia, it might seem, like that's terrible, but I look at it as just really huge potential for growth. And my question was, you said you only have one MRI and sometimes it's not functional. How difficult would it be to get private MRIs on board? I don't know how many private organizations there are in Ethiopia, because more than 1 billion people have tuberculosis, these infectious diseases. And I feel like in Ethiopia, this would be, as you said, a fantastic research opportunity.
The MR that we have has been non-functional for quite some time now. There has been talk about private-public partnership by our Ministry of Health, as well as our institutions, where it's quite difficult to purchase MR machines. But if a private sector can, we already have the place for it, we can remove the MR that is non-functional, and they can bring in an MRI where we can have a win-win situation. There has been talk, and there was some, positive move towards that, but in recent months there has been some slowdown. I'm not sure why. With regards to my institution, we are going through a transition where we are shifting to becoming an autonomous institution. So there has been, a shift of efforts towards accomplishing that, so we can get these things done as quickly as possible. So it's a slight pause, I think, in my institution, but private-public partnership is a big thing in imaging, particularly, and hopefully, for me, it really doesn't matter to me, if it's. I would prefer if our management buys a machine for us, where we can control the, the payment for patients. So if a patient comes to Black Lion or to Grand-Bassam Hospital and they can prove that they cannot pay for anything, we can do the imaging for them for free. So for those who can afford to pay, they pay the most, a minimum amount, as opposed to what they would pay in a private sector. It's great that we can have private-public partnership, because it should benefit the private sector as well. But I think it is also critical that we think of the patients who cannot afford. So the patients who come to us are not the ones who can readily go to a private institution to get whatever imaging they want. They come to us very late because they have to, sometimes come up with the funds to actually come to us. Diagnosis of patients is very difficult for us, because the tumor or the lesion is so big sometimes that you don't even know where it's arising from. So it's very hard for us to give differentials, because you can't even locate exactly where it's coming from. So we have to be mindful that it's not just financial, but of course institutions also have to make money to run. So I think we have to be careful in the balance that we strike, but yes, it is a great idea. How to implement and when is a question that, to be honest, I can't answer, but I would love to have one.
Yeah, thank you.
Thank you so much for that. Next, I think we'll have one more question. Sarah? Oh, okay, we'll have two more questions really quickly. Sarah and then Masrat.
Thank you so much from my side as well, Dr. Saleh, for your very inspirational and educational talk. You talked about different types of collaborations, be it between specialties within the same institution or different institutions within the same country, or even between different countries within the same continent, or even transcontinental. And since you have been involved in many collaborations, I'm very interested to know, do you think it's a question of geography and borders that can make collaborations easier, or is the question of the people? So for example, can a collaboration between Ethiopia and Egypt be easier than a collaboration between two institutions in Ethiopia, just because the people involved are excited enough to get things going?
That's a very, very good question. I think people matter. It doesn't matter whether you're in the same country or, if somebody in Egypt has the same vision as somebody in Ethiopia, it should work. Excellent, There are difficulties in having collaborations within Ethiopia, within the same institution. If you are not seeing eye to eye on what you want to achieve, and undercutting somebody's research and so forth. I think these kind of politics are everywhere. It's not just in Africa or in Ethiopia, but in the global north, there are whispers, should I say, where, it has been uncomfortable, where, people have had great ideas, where, they have been excluded from the work that has been done. And then there are great people and great institutions who encourage their, visionary, whether you're a medical student or a resident or a fellow. For me, I don't think it matters. As long as that person puts in the work and has the same vision and is working for a greater good. Personally, I don't think it matters to me whether that person is from Ethiopia or from Egypt or from the US or from Germany or Nigeria or whatever. But, I think it's, I don't know. I mean, everybody has different experiences, and I've had great experiences with people in Ethiopia and elsewhere. And sometimes you don't have good experiences with people in different setups. So you have to be wise, I think, and stand up for your rights and your belief in your vision and the work that you have done. And if you've done the work, and I think everybody should definitely be acknowledged for their contribution in the work that they do. And I don't think it matters where you are, in my opinion. So that's what I think.
Thank you very much.
Thank you very much for that. Next, we have Masrat. Would you like to say something?
Okay, thank you. It's Dr. Masai Gebrekida from Ethiopia, where Dr. Amal is. I am really glad that Dr. Amal sent me the invitation to join this meeting. So it was a really fantastic and phenomenal presentation. Now happy that these things start to be mentioned and being talked as radiologists from lower society like us, Africa. So I have also some initiatives in chest X-ray and AI data set curation. So I am going to ask just two questions for the Dr. Amal as well as probably for the house. The one is, how are we, once we start to integrate these data sets, annotate, label, and curate an AI model, and how are we going, you have fantastically described the challenges that are here in our country. I'm sure it's the same everywhere in Africa or other low resource settings. So how are we going to, especially like there is, you mentioned 83% show good among the residents, show a positive feedback towards AI, but there is 15% probably I expect to be like much higher than that. The attitude and how are we going to incorporate this AI to the radio, I don't know, the academics, also the practice, and how are we going to integrate the practical with the radiologists? How do you think we should approach regarding the utilization of the AI, you know, with the discrimination, the fear, the rumors about the AI taking our jobs and the like? So how do you think we have to approach? How do you, like, you are right, I feel the same, that it's going to really impact our work in a very critically scarce radiology setups like us. It's going to do something big, and it's going to help us. You know, it not only here, there are literatures that say it's globally the number of images being scanned and the number of radiologists is getting mismatched, like low number of radiologists and the number is continuously increasing. So that's why I think the essence I come to us in our setup. You know, we see 100 X-rays, probably 40 ultrasound. You know, the burden, we're so overburdened. So it's going to help. I see the potential to help, but how are we going to make it practical, and how do you think we have to approach it? The second one you were mentioning about the AI democratization and the like. I like, after like labeling, annotating, and creating data sets, it's like going to be, I think the next step is model building and text report radiology extraction. So the AI start to help augment the work. And also, so how do you see the data set, our local data set, being utilized by usually probably from the Western side, from the global north? They come and like they use our data set, train their models and build their own AI. How do you approach, how do you think about like approaching our data set being locally labeled, and as you said, probably interacting and integrating with the rest of the African continents, and like to have our own own AI algo and the you know, the disease patterns, you know everything, like it's always different from the, so we know we the radiologists, the local radiologists know how the disease patterns are, the findings and the like, the prevalence, because with our experience. So how do you see like the about the our local data ethical democratization and owning our own data set and also building our own AI model? Thank you so much. I don't think it's long.
Yeah, you're right. It's not easy to implement, and that's why, you know, during my talk I mentioned that, you know, it's going to take some time, but we have to start somewhere. And when we had our curriculum, which was reviewed, there is, you know, we have AI integrated into the learning curriculum of our radiology residency. So that's one step. So, you know, it's going to take time, but we have to start somewhere, and we have to do it cautiously and not push, in my opinion. And we have to have an understanding of the potentials of AI, and you know, not things that are developed initially for a greater good are not necessarily used for good all the time. So we have to, you know, think about this, and you know, it's like the image that I showed where there's the potential, but you have to enter with caution, in my opinion, where, you know, measured utilization of AI, you know, start off with, you know, denoising images and see what is happening with that, and you know, do your research, do work on that, and see if there's, you know, using the data set that we have to see if those implementations are working, and then you can move on to using local data sets. And we've talked about how to use the data that we have with, you know, other collaborators ethically, by establishing collaborations, working together, training AI models on our underrepresented data. And I think it answers both questions that you raised, is that there might be several ways of approaching it, and it depends where you are. Are you in a teaching institution? Are you in a private sector? Do you have the PACS, or do you have data storage? I mean, I think it's a very complex issue, and I don't think there is one right answer for it, and it has to be taken with a grain of salt and work on how to use it, in my opinion. And I think this answers both questions that you raised. Okay.
Thank you
Thank
so
you.
much, Dr. Amal. Thank you so much. This was such an engaging discussion. We learned so much from you. Thank you so much. Any additional questions, please, you're welcome to reach out to Dr. Amal. She posted her information in the lecture, and we will also be posting her information on our social media, if that's okay. You can contact her there, and we're running out of time, and it was wonderful to have all of you here today. Thank you so much. Thank you so much, Dr. Amal.
Thank you for having me.
Have a great day. Thank you so much.
Thank you.
Thank you.